Hello, my name is Douglas Bloch. Welcome to another edition of One-on-One with the Depression Counselor. Today we're going to talk about a very controversial treatment for the treating of severe depression called ECT, or Electroconvulsive Therapy. Another name for this is electroshock therapy. And I'm going to start out with posing the simple question, what is ECT? Well, electroconvulsive therapy is a treatment for severe life-threatening depression and manic depression where the brain is stimulated with a strong electrical current that induces a grand mal seizure in the brain similar to that of epilepsy. And in a manner that is not quite understood, this seizure sort of reboots the brain and snaps the person out of their catatonia and their severe delusions or their stuck place, and gets the brain going again. Again, people don't understand why this works or how it works, but it seems to work in practice. Now, ECT was introduced to America in the 40s and 50s in large institutions, often for people who are severely delusional, often psychotic. And later on, with the introduction of effective drugs, ECT went out of style, but it's recently made a comeback and it's being used more and more frequently. Okay, well, the next question that I want to address is, how effective is ECT in treating severe depression? And the studies find that it is especially effective at treating severe depression and delusional depression compared to other therapies which haven't worked, like antidepressants. Some studies show that ECT is just as effective as antidepressants, while others show it's even better or superior to antidepressants. This is especially true of older people over 65 years old. And what they find is that while traditional medications take 4 to 6 weeks to be effective, ECT often starts to be effective in the first or second week. Usually what happens is the person is either hospitalized or there's an outpatient treatment. They get treatments on Monday, Wednesday, and Friday, 3 treatments a week, and this usually goes on for 9 to 15 treatments. So by the 6th or the 9th treatment, you're usually seeing some improvement. I want to quote a nurse I once knew who gave me this quotation to share with you. She said that, "I have seen severely depressed people who were unable to dress or feed themselves. I had to change their diapers because they were so regressed and so withdrawn. By the end of their ECT treatments, they were smiling, eating and drinking on their own. It's as if they had been brought back from the dead." And I'll share some personal stories about that in a few minutes. Now, although, as you can see, these treatments are very good at snapping people out of their deep depression, oftentimes there can be relapses in the next year unless ongoing maintenance therapy is provided. This is usually done with antidepressants or with what's called maintenance ECT, where maybe 2 to 6 times a year a person gets follow-up doses so they can maintain their recovery and not sink back into their prior depression. Okay, so now we've described what ECT is. It's a grand mal seizure induced to the brain that restarts or reboots the brain, and we know that it's effective or even more effective than antidepressant therapies, especially when a person has intractable depression. Now the question is, why is it still so controversial after all these years of it being proved effective? Well, there's a number of reasons for this. First of all, the way it's been portrayed in public, especially through the movie One Flew Over the Cuckoo's Nest, based on Ken Kesey's book, out in the 70s, a remarkable movie, won 5 Academy Awards, very popular, and there's one scene in which Jack Nicholson is portrayed as having ECT as a punishment, and it's a very gruesome scene, and I think that has imprinted itself in the public's mind and have given them a real fear of the procedure. Secondly, the procedure itself is quite invasive. It's quite gruesome. I mean, imagine, giving a major shock to the brain. This conjures images of terror, of Frankenstein, and it's a kind of a scary thing when you think about it. And you may ask the question, well, how can such a barbaric procedure, seemingly barbaric procedure, help anybody? The third reason that ECT remains controversial is that it has side effects. This is particularly true in the early days when people were just getting into it. The shocks were really strong. They hadn't been using muscle relaxants, so people's body would shake. Oftentimes there'd be broken bones. But now with the use of weaker currents and with muscle relaxants, it's actually quite safe. We don't have any of these old side effects, except for one that does persist, and that is memory loss. Now, this memory loss is usually about memories at the time of the procedure. So some of my clients, when I ask them about their ECT that happened 2 years ago, they don't remember it, or they don't remember what happened a month before it or a month after it, but the rest of their memory, going back to childhood or even a year or two, 3 before, is still intact. Yet there have been reports in the literature and on the internet of people saying that vast parts of their history, of their biography, were wiped out by ECT. And of course, that can be a scary thing. So there are these risks. I think they're not as big as often as played up in the media, but they are there. And so therefore, ECT should be reserved for people where everything else has failed. It's often called the method of last resort, and so it should be. So now I'd like to talk to you about my own personal experience with ECT. I've never had it. I was actually evaluated for it and would have probably received it in 1997 had the prayers for my recovery that I talk about in my other video, Healing from Depression Naturally. If those had not worked, I think I was in line to get ECT. I was actually being evaluated at a local hospital. However, there is another relative of mine who did get ECT, and that was my mother. At age 79, one day she was swimming in the pool at her retirement community. She got a little chilled, and my father was late in picking her up, and by the time she got home, something had shifted. She started to get really psychotic. She was terrified of the cicadas coming out at night, these lovely insects with these songs. They once really were very pleasant to her, and now they started to terrify her. And over the next month, she stopped eating, she stopped drinking, she would stare out her window and wouldn't leave the room. She lost 40 pounds and became essentially catatonic. So we checked her into the hospital, into the gerontology ward. They evaluated her and decided that her depression was severe enough that she needed electroshock therapy. She got 9 treatments over a 3-week period, and by the end of that 3rd week, she was talking, eating, and like the nurse had said, back to her old self. Unfortunately, she had a number of relapses, but every time she went back into the hospital and got an ECT, she recovered and lived free of depression until she died at the age of 85. Other experiences I've had have been with group members. 2 people came into the group, one who got ECT during the group, one who had gotten it before. They were both high-functioning professionals. They were laid low by this kind of catatonic depression, and in each case the ECT was effective. They were able to go back to their old jobs and maintain their recovery. So again, my personal experience with my family, with my clients, has been that this thing works, and therefore I'm much more open to it than I was before. So in conclusion, from what I've read about ECT, and particularly my personal experiences with ECT, have shown me that ECT is a valid therapy. Electroconvulsive therapy is a valid therapy that should be used when all others have failed. Now I know there are risks of memory loss, but in some ways the risk of not acting is worse than the risk of taking action. This is especially true when a person is catatonic, is not functioning. I mean, you can't just let a person, be like that long period. They're eventually going to die of their disorder. So when something gets that severe and nothing else is working, I think ECT should be tried, and with an 80 to 90% success rate, the odds that things good will happen are much greater than things negative. So again, this promises to be always will be a controversial therapy until we can find methods that are more, shall we say, less invasive, and there actually is one called transcranial magnetic therapy, TCM. It's now being approved actually right here in Portland, Oregon. They're using it in the Kaiser system. So this is where you run magnets over people's head, and you also induce an electrical current, but not quite as violent or intense as ECT. And the results are coming in that this may be effective and, again, less fearful. Nonetheless, I do think that ECT has its place and in certain situations should be used. I hope you've learned something from this video. And until we meet again, this is Douglas Bloch signing off. I wish you the best in your mental health recovery.